Hello, everybody, and welcome back to the Beat podcast, recorded live here at Health in Las Vegas. And I'm just thrilled because we finished day 2. It was awesome. And I get to start day 3 with no one other than Logan. She's the president and CEO of NASCO. And Lori works closely with leaders across health plans and NASCO to deliver a holistic portfolio of healthcare administrative products and services that put health plans in control of innovation, delivering better experiences, and driving affordability. Lori, thanks for being with us today.
Yeah, good morning. Happy to be here.
Yeah. How was day 2 for you?
Day two is pretty packed. I get to spend a good bit of time on the floor, seeing some crazy cool innovations in healthcare. So it's exciting to see that. We have to keep trying, keep pushing, keep moving, and excited to see everything that's out there.
Good. And you did a foodie tour.
We did a foodie tour.
How about that?
That was fantastic. We got to go to 3 different places, had a lot of steak, a lot of really cool cocktails and things with it. It's a pretty cool way to experience Las Vegas.
Love it. You guys are doing it right. Business and play. That's the way you do it here at Health and also in Las Vegas. Lori, let's start with, I know I hinted a little bit about what NASCO does, but why don't you tell us what you guys are all about?
Yeah, so we are a healthcare administrative product and services company. And what does that mean? We largely help health plans bring together the benefits and innovations that members, patients, consumers need and pay for them and administer the payments behind them. So it's really, we're in that core ecosystem mode of what a health plan does to package all this stuff together, get good benefits out to constituents, and really drive for affordable care. It's why this is such a great venue to see all the innovations out there. But you need plans to put that together to get it into the hands of the members and the stakeholders to leverage them.
You definitely do. It doesn't happen on its own.
It doesn't happen on its own. Plans can do a lot. Providers can do a lot. But if the patient and the member doesn't do anything, it just doesn't matter.
Yeah, totally. Okay, so you've been here. What are the most significant challenges that you're hearing from payers? What are they facing when transitioning to alternative payment models with providers?
Yeah, I think plans are under the gun right now and have always been. Their role to provide affordable health care. Some years are good and some years are tough. But I think what they have now is just this plethora of different things coming at them, different competition, and redefining their role and who they are, the packager of all these innovations and plans. So I think right now they don't have the infrastructure and the systems to be able to do that. They're still working on 30-year-old health plan technology and infrastructure that's just not able to handle the modern needs and innovation of healthcare. So first and foremost, it's complexity and doing anything at scale. And in healthcare, if you don't do it at scale, it just doesn't matter, right? You're just not going to go after the mission that you're trying to fulfill.
And when you talk about the complexity, what are the different things? There's transacting, there's signing people up, there's provider rosters.
Yeah.
Like, help us understand.
Yeah, great question. So I think when we think of a health plan, we traditionally think of their medical network. Everybody has healthcare. You have a PPO or an HMO network, but the world of healthcare delivery, and if you look at the floor here, it's not always in your network anymore.
Right.
So there's this whole plethora of all these other benefits and clinical services and great condition management programs that are sitting all out on top of that.
Got it.
And there's no place to administer those. How do you know as a member what you have for those benefits? How do you know where to go to navigate to them? How do you know? We talk about transparency in a world that's based off of claims in your doctor's office. But what about all these other programs? How does transparency work for that? So I don't know where to go. I don't know what's going to cost me. And I'm wildly confused about that. So there's complexity from a member perspective. And then what the health plan does is trying to manage that risk. Where are all the dollars going? Who do I attribute value to? If there's all these clinical programs plus my medical network, who's playing what role and how do I know what's working and what's performing? So there's just this whole network of added benefits and programs and things that have been built outside of the claim system. And the world has evolved around the claim in healthcare. Still really crazy important, but it's not the whole world.
Wow. Okay. I love that. Thank you so much for the context there. And yeah, there are so much on the show floor, the digital front door. There's so many different options, direct primary care, like the list goes on. And so with increasing pressure on affordability, how can payers leverage predictive analytics to proactively manage total cost of care while at the same time enhancing that collaboration with providers?
Yeah, I think there's 2 ways. Predictive analytics do a great job of figuring out what patients need what type of care But then you have to get that into the hands of the provider to help them navigate, or whoever is going to be their advocate and whoever is going to help them and assist them. So when we talk about things like agentic AI, it's helping the individual to human in the loop to help navigate that member around. So both who needs what care, and then how do I get it out to the provider to help them to succeed in their mission too, of providing good care at an affordable rate, right care, right time, right place. But it's an economics game. They have to get paid. They can't hire nurses if they're not getting paid to provide that type of a care coordination circle, for example.
Got it. Yeah. And so the analytics of it all, it's challenging. Like, how do you help with that?
So analytics, actually, when you start from it from an analytics angle, isn't always crazy hard, but you have to get past the data we've always used in the past. It's not just in claims data. It's not in clinical data. The world of engagement is what the members are actually doing, what the patients, consumers are actually doing. So you have to bring in all the data, and you have to bring it in with an eye in mind of why. What are you trying to get out of the data? You're trying to get the who do I focus on for the what? And then you really have to get to the how much. So we look at it all about medical economics. Like, we administer benefits and payments, right? And we do that because it's an economics game.
Yes.
So if you don't look at your analytics with the precision to know about the financial piece of it, then it's not going to work. It's directive, but it's not helping them to run the businesses of healthcare that they need to do. And business is part of healthcare to do that. So we look at analytics as bring all the data in, but inform the caregivers, inform the advocates, inform the folks that are helping the member navigate, but mostly inform the care providers so that they can get paid and know how to do that.
Totally. Yeah, you're right. Like, we have this legacy data that we've always relied on.
Yeah.
And then signal from noise, what's out there. That's where NASCO comes in, and you guys help.
Yeah. So we have a great claim system. We've been in the business for 40 years, have always managed really complicated benefits. Our name's actually National Account Services Corporation. So we started from the national account space, large employer groups. The largest payers of healthcare are the ones that drive innovation, national accounts and the government. So we've always dealt with that complexity. So when we looked at the analytics challenge, we knew it had to be dealt with complexity right up front and do it in a way that scales. So we think we bring that complexity, holistic lens together, all the data points, the entire ecosystem of the plan to help navigate the member to the right benefits and make sure that works and it gets paid for. So we added the complexity in, but we also added in the payment angle of it. Because again, if it doesn't, it's a medical economics game. And if you can't get the payment administration to work, nobody gets paid, the engine doesn't come around.
Totally. Yep. That's very clear. So payers, providers, they're navigating this transition to alternative payment models. What strategic investments, whether infrastructure, relationships, or policy, are essential today to really ensure long-term alignment, scalability, trust in the ecosystem?
Yeah, so I think they're twofold. You need the systems and the chassis to be able to administer the stuff. It can't be done off of the side of desk anymore. It can't be done in spreadsheets. It's big and it's complicated. That's a need for systems, right? And systems thinking to be able to administer that with it. So I think that's one category. Invest in the other systems to play the role that the claim system used to play. Again, claims still important, but you have to administer all of these programs, all of these services to do that. But the other piece is to power the provider, really, and to share with them too that. We had a great panel earlier this week with Lori Aronson from Blue Cross Michigan, and where she even said it's a great quote that they underclubbed was the operational piece around it. And it's both the systems operations, but it's working with the providers to do that, coaching them, helping them, relations to them. We want them to win in this value-based care model, in this this administration, and they need help to do that. A lot of the role that they're doing is what a plan has done before. Aggregate the data, look at the economics. How do you do patients navigate? We have to help the providers do that. They can't do it on their own. So there's a we in this to do that. And I think she also said it's a great point too, like we do, you do. So you have to really understand the roles. There's roles for both. It's not one or the other. This is a collaboration. So that operational mindset to help them, which is really driven on a relationship and one of trust, aligned incentives, that's what makes the world go round with that. So I think that component to really help the providers and coach them is an area that we're coming back as an industry and realizing we need it to do that. It's crazy important.
Totally. Yeah. Some great call outs there. The need for collaboration and clarity in roles, understanding where you're going, right systems. You're not going to get anywhere without any of that.
That's right. That's right.
So how long have you been in the role, Lori?
Yeah, I'm 6 months in the role of President and CEO.
All right.
Yeah,
well, that's awesome.
So 2.5 years with the company. It's a pretty wild story of NASCO, but I'm thrilled to be here because I think we can help drive all this innovation that you see on the floor here and collaborate with the plans to get it out to the members and patients, right?
I love it. So as the CEO, you've got a vision for the future. Looking ahead to the next 3 to 5 years, what bold bet is NASCO making that you believe will truly transform this healthcare experience?
Yeah, I think we're going to help plans redefine their role and level up to be able to do that, right? They need to bring these programs together. They're in the best place to make a massive impact is through the plans, right? To do that. And it's not just about their medical network. It's about all these programs embracing the innovation. So we really are here to help them innovate and grow. And if they innovate and grow, I think we start to see the economic turns in healthcare. And we think we can enable that. We come from scale. We come from large systems. We come from understanding what healthcare needs and that innovation front. So our focus is on innovation, growing it at scale.
Hey, listen, with you at the helm and with that vision, it's exciting what is ahead. Lori, thank you so much for spending the time with us today. I've really enjoyed it, and I know the listeners have too. Is there anything that you want to leave as closing thoughts for us as we close today?
Yeah, I think I really covered it, but what I would say and what's so energizing about this event, embrace the innovation. It's not a one-off thing. Build the innovation engines. You have to build the chassis to get the innovation out there. It's not going to happen one at a time. We're going to learn from this, test it, learn, but it's a human-centered business, right? This is about patients. This is about members. This is about consumers. So be there to enable it.
That's brilliant. And if people want to learn more, where can they visit you, follow your work, learn more about the company?
Yeah, it's NASCO.com. We just did a rebranding this year, so you might see us out in the market a little bit. Yeah, it's pretty exciting.
Check that one out.
Yeah, so watch us on LinkedIn. We've got some great thought leadership. We are all about affordability. And to get to affordability at scale, that's what we do. So keep an eye out on us.
I love it. Yeah, I appreciate you leading the way. And in the show notes, we're going to leave links to the website, the LinkedIn, so that everybody can check out the rebrand, but also the thought leadership work that you're doing. And so can't thank you enough for joining us, Lori. Really appreciate it.
Great to be here. Thanks so much.